Welcome to the Like a Boss podcast presented by the Portland Press Herald and sponsored by Bernstein Schurer, New England Cancer Specialists, Live and Work in Maine.com, Harvard Pilgrim Healthcare, People's United Bank, and Vistage. Now here's your host, Portland Press Herald publisher and CEO, Lisa DeSisto.
Welcome to Like a Boss. I am here today with Chuck Hayes, President and CEO of Maine General Health, and we are on our Central Maine Like a Boss mission, sharing some of the best practices and meeting the leaders here that make Central Maine tick. So let's welcome Chuck.
Oh, thank you very much. I'm glad to be here.
We are sitting here, I'll describe to you, in the Kennebec Savings building, and it's a beautiful 200-year-old facility, and just continuing with all the important conversations that have happened in this space for the past 200 years. So maybe Chad can take some pictures so we can post those along so people can see how wonderful this is. So let's start by meeting the boss and tell us about where you grew up.
I grew up in West Newton, Massachusetts, so just outside of Boston.
And now, does West Newton go to Newton North or Newton South? Where'd you go to high school?
Newton North.
Oh, you did? Okay.
Yeah.
I won't even get into that whole rivalry, but I understand it's probably just as intense today as it was then. And you went to college, and what did you study?
I went to Massachusetts Maritime Academy, studied marine engineering.
Oh.
And then I went to Bentley for my master's in business and finished my master's at Thomas College.
Oh my gosh, we talked to Laurie LaChance from Thomas College. So all the worlds are colliding here on Like a Boss. Now, so what was your first job?
After college?
Or you can give me either one. Your first job ever.
Yeah, my first job ever was when I was 14 and I helped an old lady move.
Oh, wow.
So I spent the summer packing and moving her, but my first job out of college was a nuclear test engineer for General Dynamics.
Oh, wow. Like just diving right in. Now, where were you when you did that?
Groton, Connecticut.
Oh, okay. Yeah. Wow. So then how did you get on a path to your position today? And tell us about your path to getting to Maine.
Sure. So when I graduated Massachusetts Maritime Academy, General Dynamics put me back to school for nuclear physics and to become certified as a supervisor of nuclear testing for their submarines. So what I used to do was do the initial criticality testing for their 688 fast attack submarines. And when I first graduated college, I was deciding whether to go with General Dynamics or General Electric, so that the offers were the same to be a nuclear engineer. And at the time, General Electric was offering what was a huge sign-on bonus to me. I put myself through school, so I had a little debt, and they were offering $5,000. So I said, boys, that sounds like a great opportunity, but it was in Schenectady, New York. Mm-hmm. And as you can imagine, having grown up in the Boston area, and the sports team rivalries between Boston and New York, I thought, at 21, I would be disowned by my family if I moved to New York. So I decided to go to Connecticut.
Yeah.
But about 2 years into my stint in Connecticut, General Electric cut a deal with General Dynamics, and off I went to Schenectady, New York.
Oh, my gosh.
To help them with one of their reactor projects in Schenectady. It was a part-time. It was for probably 4 months. But at that time, I said, I'm going to decide for myself really where I want to work and what I want to do. And so I moved back to Massachusetts, bought a house in Waltham, and started doing consulting for the electric utility industry and for the nuclear plants. I did that for 7 years. It was very fun. A lot of travel, a lot of picking, you'd pick up the phone and they'd say, well, the NRC shut us down. We'll buy your clothes when you get here. Can you fly out to Tennessee in an hour and a half?
Wow.
And I'd go to Logan and off I would go.
You cannot get to Tennessee in an hour and a half, by the way, because my mother-in-law lives there. I know that. So anyway.
Fly out of Logan in an hour and a half. So I'd have an hour and a half to get to Logan, and then boom, I'd go to Tennessee. So, which was exciting when you were younger. And then I started having kids. And one time I came home, and my daughter, who was always kind of iffy with strangers, I picked her up and she started to scream. And after I'd been away for a couple of weeks, and I said, yeah, it's time to change jobs and find out what I really want to do. And so I thought long and hard about it. A lot of my family was in healthcare. My wife's whole family was in healthcare. And I said, what a great job, being able to take care of the community and do those sorts of things. So I said, I should see if I could get into healthcare. So I started looking. There was a job opportunity that was in the Boston Globe. Mm-hmm. And it was to be a consultant for healthcare, mainly housed out of Maine. Oh. And since I loved hunting and fishing and being outdoors, I thought, what a great opportunity. And so I applied and got the job as a consultant. My first job was at Mid-Maine Medical Center, what was Mid-Maine Medical Center at the time in Waterville. Mm-hmm. It's now Maine General. Mm-hmm. And so I took over their engineering department and worked in the capacity for them as director of engineering, but also kind of went around the United States helping other healthcare organizations with compliance and engineering matters and things like that.
So it was that job then that moved your family
it was.
to Central Maine, right?
Correct.
Right.
Yeah.
Wow. So give us the Maine General by the numbers, just in terms of employees, doctors, nurses, patients that you see annually.
So we have about 4,300 employees.
Wow. So that makes you one of the biggest, if not the biggest employer in Central Maine. Is that
correct,
right?
Except for the state.
Yeah. Oh.
Yeah.
Okay, but they're not all here.
Right, exactly.
Right, okay.
Exactly.
So I think you're number one then.
We have about 400 people on our medical staff. Roughly 250 are doctors. Mm-hmm. And our nursing staff, both nurses and CNAs, is about 1,300.
Oh, wow. So, okay. So, and then how many patients do you see annually? Do you know that
We
number?
cover a region of about 190,000 people.
Oh, okay.
But we probably see around 120 to 140,000 people a year.
So, like 2/3 of them then, right? If my math
I mean, we get a lot of summer vacationers and things like that, so it's not a direct correlation.
Yeah. Right. Oh, that's interesting. I never thought about the seasonality of your business here. So summer is probably your busy season, right?
It is for the emergency room.
Yeah.
It's very busy in the emergency room in the summer.
Oh, wow. All right. So let's talk about your leadership. So 4,300 people, more than 100,000 patients a year. And one of the things when I think about your career is you were really the driver behind this whole idea of regional healthcare in Central Maine and getting people or 3 different institutions to come together to build the Herald Center for Health. So talk about how that all came together and what some of the biggest challenges were that you had to overcome to get everyone together.
It wasn't easy. Certainly, when we first proposed it, it was met with a lot of resistance. Mm-hmm. And I think our community, and quite frankly, at the time, our medical staff wasn't ready for a regional hospital. So at the time, we took a step back. We built what we called a clinical council, which was half medical staff and half administration. And we said, okay, if we don't think regionalization is the answer, then what is the answer? Because we knew that the current setup wasn't working for our community, wasn't working for recruitment. And so they went off on a year-long journey to say, what are our options? In the meantime, we had an immediate issue with our oncology, where we had 2 linear accelerators, one in Augusta and one in Waterville, both in the basement, that needed to be upgraded. and the new linear accelerators wouldn't fit in the 4-foot concrete vaults.
I don't know what a linear accelerator is.
So it does radiation treatments.
Oh, okay.
Yeah.
Thank you, Mr. Engineer. Thank you.
So we knew we couldn't move a 4-foot concrete wall, so we had to figure out what we were going to do. So we decided to say, let's trial it and see if regionalization works. So we built the Herald Alphon Center for Cancer Care. Mm-hmm. And when we started that, we knew that in order for regionalization to work, you have to provide a better service.
Right.
If it was the same old service, and people had to travel, then it wouldn't be worth the traveling. And so we sat down and we really basically sketched out all the different interactions a patient would have when they had cancer. And came up with this big spider graph, and then said, how do we make it better for the patient? And so inevitably what we did was the majority of those services we centralized in the cancer center. So in the old way of doing it, they would come in to the cancer center and we would say, go over here and get your lab results done, and then go talk to this general surgeon, and then go over here and have a meeting with the pulmonologist, and then go to x-ray, and get your x-rays, and then get all that information and come back, and we'll talk about, what we can do to help you with cancer. And so what we did was we consolidated all that in one place so that they had one place to go, and we had the specialists there, and we had the diagnostics there, and we had the labs there, and then we also had navigators to help them, work through the process, because cancer is a very scary diagnosis, and the cure is also a long process. It takes many different steps. So we also have put in navigators to help them through all those steps. So we're very fortunate in the success of the Herald Alphon Center for Cancer Care. When we first opened up, we were hoping that we would take care of about 700 of our community members. And 10 years later, we've taken care of 9,400 patients, so over 940 a year, which we're very thankful that we were able to take care of those folks in our community.
Sure. And then the navigator, so that's an interesting role. So was that a new position that was crafted out of the work that you did?
Exactly.
Yeah. And what are the skills of someone that would be in a position like that?
Well, somebody that understands all, of the different services, understands the processes, can explain, both educate the patients, because the hardest thing is when you have a lot of questions when you get a cancer diagnosis and you ask those questions, but because you've gotten the cancer diagnosis, you're not hearing a lot of it because your mind is racing.
Right.
So the navigator also helps to loop back and then reinforce those things and explain things to people, and then help them, walk through the process of the cancer treatment. Mm-hmm.
So if the cancer center was really the first step in proving that regionalization could be successful, how did you take what you learned from that and then keep it going?
Yeah. So meanwhile, we had our clinical council working on different options, and after they sat down, we looked at things. Do we do a small specialty hospital and a larger medical hospital? And we looked at all these different alternatives. And at the end, the clinical council came back and said, you know what? Regionalization is the answer. Mm-hmm. And so at that point, we move forward with combining our inpatient services in one location.
So that had to be a long, challenging, often frustrating process. Talk about your role as a leader in that, and what are the kind of characteristics of your leadership that enabled you to see that through, but also to really get other people on board.
Yeah, I think really the key is, I think in leadership, communication is key, and quite frankly, you have to be out in the community. So when there were marches in the streets and there were people talking, we were there. Yeah. We weren't hiding from the conversation. We were trying to explain it. So I think working through all of that is critical, but I think you've got to give the why of any decision that you do. And some people may agree with it, some people may not agree with it, but at least they understand what the expectation. And we're fortunate in that when we first started this, one of our major issues was recruitment of specialists. So we had 3 different hospitals. I'd say two of them were larger hospitals, where we had small groups of specialists. So maybe 2 cardiologists in one and 3 cardiologists in the other. And so you're trying to recruit and say to a cardiologist coming out of school, you want to be on every second night and every second weekend, or every third night and every third weekend. And they're like, no, I'm going to go to this group of 5 and be on every 5th night and every 5th weekend.
Yeah.
And so we were fortunate in that when we did come together, our specialty recruitment has been incredible. Mm-hmm. So it's really been better than we ever hoped.
So it really gives the staff more flexibility.
Right, and it gives them, quite frankly, more of a work-life balance.
Yeah, right.
And it allows us to hire the specialists that we need to take care of the community. So that's
So, well, let's talk about recruiting then. So as Central Maine's largest employer, we must spend a lot of time focused on recruiting and also retention strategies, right? I mean, sometimes you got to think about keeping people here.
Yep.
So what are your strategies to make sure that you have the best staff in every position?
For us, we do a couple of things. I mean, one is we include our staff in the decision making. Mm-hmm. So for one, from a retention perspective, we have, even though we're not a union employee, we have at will. Our staff members are at will. But we have created really a 4-cause process for them. Mm-hmm. And so they basically, if there is, say, a termination or a management discipline, they have a group of peers that they can go to and that can overrule that.
Oh.
And so we have a group that's trained. Mm-hmm. That evaluates, anything that people want to bring up to them, and ultimately their say is the final say.
Oh wow! Is that unique?
I'd say it's fairly unique. Mm-hmm. Yeah. I'd say the other thing that we do is, as we recruit, we both do full personality profiles on every single person who comes in to Maine General. Mm-hmm. We want to make sure that no matter what your job is, you have a service bent, that you're here for the patients and the community. Mm-hmm. And what happens is the management goes through and may pick 2 or 3 good candidates that they think could do the job, and then a peer group of staff interview those 2 or 3, and they ultimately make the decision on hiring. So they need to make sure it's a good cultural fit for both the job and the group that they're working with.
Oh, that's wonderful. So it's really a combination of your experience, your education, but also if you're going to be a fit.
Exactly.
Culturally. And that's got to show to the final product with your patients, right?
It certainly has helped. I mean, we have the highest patient satisfaction out of any large hospitals in Maine, and it's really the people that we have working for us.
Yeah. Now, so what about recruiting doctors? Are you going out of state to find doctors? Is there movement between the health systems in the state? What's the latest?
I'd say there's some movement, but I'd say the majority is either out of state or newly graduated from UNE. We have a residency program with Dartmouth. Uh-huh. So it's one of the oldest residencies in New England.
Oh,
it started in the 70s. So we recruit a lot from there. But mostly I would say it's from those groups and out of state, and a little bit of movement in state.
Mm-hmm. So what's your sell for getting new doctors or recently graduated to come to Central Maine? What's your pitch there?
We used to sell a lot, We used to tell them, I mean, our biggest thing is, one, the beauty of the state. The people here are incredible. And it's a fantastic place to raise a family.
Right.
But we also asked them, have you ever seen snow before?
Yeah.
Because we used to do such a sell, and people, you'd get a few of the people would be like, I always wanted to live in a place with snow, and now we go, yeah, no, not a good fit.
Yeah, right.
Because it usually doesn't work out, or somebody who says, I lived in the city my whole life with my family, and I always wanted to live in the country. Those usually don't work out if you don't have that outdoor interest already when you come here.
Right.
So that's a challenge. But I think just the area, the people.
But now, we both grew up in Massachusetts. Don't you think they make a bigger deal out of snow in Massachusetts than they do in Maine? It's it's no big deal. You just get in your car and you go to work.
That's because Maine knows how to take care of snow. That's what I say.
Well, I think you're right.
In Massachusetts, they
oh, you don't have school for a whole week.
Yeah, exactly.
It's crazy.
And they don't remove it, right?
Right, that's right. So we also hear a lot about the shortage of nurses as, kind of a generation of nurses is approaching retirement. Is that your reality at Maine General? Is there a nursing shortage? And what are you doing to mitigate that?
Right now we're doing fairly well. I'd say we have some shortages really in the specialty areas. So critical care, ER, behavioral health, hospice. Those that take more training for those, and it's really people with experiences is what you're looking for. So we've actually started our own kind of residency programs in those areas, so taking people who have some nursing experience but no critical care or ER, and we'll partner them with a seasoned nurse and train them to come up to speed. But I can tell you the data doesn't look good from a nursing shortage.
Right.
It's pretty scary. In the next 5 to 10 years, the amount of nurses that are going to retire is incredible.
Yeah. So I understand you have some partnerships with some of the local colleges and universities to help think about how to get your workforce ready for years to come. Can you talk about any of those?
Sure. I mean, I think we're partnered with all the local ones. We partnered with even Gardner Adult Education for our CNA program. We started our own CNA program, partnered with the career centers and created a medical assistant program. And certainly we partner with UMA and KBCC, the community college in Fairfield. So we have a lot of partnerships, but we also see about 700 students a year come through the medical center. Everything from pharmacists to doctors to lab techs to rad techs. So
wow, so it must be a pretty vibrant place from all the the staff coming through and people learning on the job.
It is, and the nice thing is when they come in as students, you can tell who's going to be a good employee and who's not, and you can actually hand pick some of those folks as they come out of there, as they graduate.
So you mentioned earlier communications being key to being a strong leader. What's your communication style?
Well, people tease me about being an engineer.
Right. So, well, yeah, I can see that already. I had a chance to. Yeah.
To me, I think you just got to be authentic. You've got to be real and tell people, what's happening. Give the why behind your decisions, as I've said in the past. We've obviously got a big organization, so we do things like I put out a Friday report to all staff to say what happened this week in an email. It's just a one-pager. Tell them what's going on. I also do CEO forums, so twice a year, once on video.
Yeah.
I send out to everybody, and then once in person.
Okay.
We have about 26 meetings with staff all over the organization.
Yeah.
To do a face-to-face, tell them what's going on, what our goals are, what we're working on, how we're doing, what we need to improve on. And then we have many other ways of communicating with staff. But, it's certainly a challenge. We have a large group and it's pretty spread apart.
Yeah. Now, does everyone in the organization wear a name tag?
Everybody in the organization.
Okay, so that's good for you, right?
Yes,
because then as long as your eyesight's good,
exactly.
you can just be really authentic while you're reading there. Yeah, name tags. I wish everywhere I went, people had name tags on, including Hannaford, because sometimes you just see people you're like, who is that? So speaking of Hannaford and the community, how do you stay in touch with the community? Because you really have to figure out what's the best use of your time, and there have to be a lot of polls for you to be really active in the community. So how do you figure out what is the best use of your time?
Yeah, it's a balance, but you become really active in the community.
Right.
You're on the chambers, you're on the different boards where you can meet and find out what's going on in different areas, get feedback from people on things that you need to improve on. So both in Waterville and Augusta, I'm on quite a few boards and go to them diligently, but then you also cycle through too, because obviously running a healthcare system is the number one priority.
That's right.
So and I tell, because if I sign up for things, I like to be there too.
Yeah.
So in some instances, I'll tell people, I just can't do that because I can't make the time.
Right. I mean, the community, they're your customers,
exactly.
Right? So so there's an expectation of you there. Now, let's talk about what are Central Maine's biggest health challenges right now, and what role does Maine General play in building a healthy community?
So we do what we call a community health risk assessment every 3 years, which is a full-blown assessment of really what the health challenges are in the community, and then we update it every year. But then we put together a full plan. So really, for us, we have a group, Prevention and Healthy Living, that focuses both on the evidence-based medicine of prevention, tobacco cessation, obesity, things like that. But then we have the healthy living side, which has been funded by the Peter Alfond Foundation, which looks at non-traditional medicine to keep people healthy. So whether it's acupuncture, yoga, meditation, things like that. And that has really expanded for us. We've had 130 classes this last year, for 2,600 people that have come to those classes. So,
wow.
And for me, our whole focus is really how do you keep people healthy. I think with the cost of health insurance being so high, the answer is really working on prevention. Unfortunately, it's not reimbursed, which is some of the challenge.
Yoga, meditation, those aren't acupuncture, not reimbursed. Yeah.
None of the all the prevention stuff, even the tobacco cessation, all of that. It's all we do. Really push grant funding. We get a lot of grant funding for those, but there's no reimbursement for most of those.
Yeah, but yet they're so important to the health of the community, right? Especially, so many components of that. So let's talk about your team, your leadership team. So you have to surround yourself with a team to advance the hospital's goals and effectiveness. Who's on your team? What are the critical roles? How did you build that team?
So we have our Vice President of Marketing and Philanthropy, Chief Operations Officer, Chief Financial Officer, we have Chief Nursing Officer, Information Technology, we have Chief Medical Officer, Human Resources, and Strategy. And so that is our team, and we've built it over time. I mean, we have a group that's both compassionate and accountable and focused on goals and outcomes and hitting our mission of having a healthy community in the Kennebec Valley. So it's taken time. I've been the CEO of the medical center for 10 years now. I've been in the area working for Maine General 22 years. So it's been we have a great team.
How do you, so with that team, are you setting the goals for Maine General and do you do it on an annual basis? Do you have a 1-year plan, a 3-year plan, a 5-year plan? How do you navigate all that?
So our goals are fiscal year. And our fiscal year starts July 1. And we sit down way before that in the January, February timeframe, and we start working on our goals for the year. So the senior leadership team develops the goals, then the board reviews and makes adjustments to those goals, and then we finalize them at a system level. So these are the goals that we want to see at a system level, and then those get pushed down to the companies, and then from the companies they get pushed down to the managers.
So everything cascades. Now, the manager may ultimately be able to impact 2 system goals. So those 2 will be theirs, and then they may have things that they need to work on
in their departments, and so they'll add goals as they go. But we have a whole system, and every leader at Maine General, their evaluation is based on the outcomes of those goals.
And how often are people checking in on them? Do you have a formal process, informal process?
We have a formal process.
Yeah.
So it's they check in more often, but quarterly.
Yeah.
They have to. We have 90-day plans for every goal. How are you going to improve the goal? And so basically, we look at, obviously, the 90-day plans start at the beginning of the year.
Right.
And then you check in, how's that goal going? What do you need to do to improve? What's your next 90-day plan to move the ball on those goals? And so that goes all the way up from me doing my 90-day goals to every manager in the organization, every leader. Yeah.
Now, how are you doing on your 90-day goals right now? You doing all right? Because they just started July 1, right?
I have till tomorrow to finish them.
Oh, you do?
Yeah.
Okay. All right. Well, we should wrap up then, so you can go work on that, because I think that's important. Now, I know you just finished your term as president of the Maine Hospital Association. So, what are your takeaways from that experience? And describe the relationships between competing hospitals and health systems. Like, do you have a shared mission, or what kind of competition is going on?
Well, the Maine Hospital Association chair was a great experience for me. It was interesting to see some of the inner workings of the legislative process, both at the state and the federal level. So, to me, that was great. I would say overall, we certainly compete with each other in Maine, but almost everybody is focused on the health of the community and works well together. Like, even those community health needs assessment, what we do is the CEOs of the major systems get together and we fund it for the entire state. And so we work together to do that community health needs assessment. It's broken up by county, so every person can kind of take their areas. So there's a lot of collaboration in the state, but there's always competition as well.
But I guess really everyone works together because it is about the health of the community, right? Yeah. I mean, I would say too that we support the Bangor Daily News in that we believe that everyone needs to have quality information, right? So even though you compete with them, it's important that
everybody knows about the patients. So,
right, yeah. That's right. Everyone does good work. All right, so let's wrap up with our kind of classic like a boss questions. Now, this is a hard one that usually stumps everyone, which is describe a typical day in the life of Maine General Health CEO.
Well, get up about 5. Get into work around 6 or 6:30. You start your day of meetings, which could be on a variety of topics. Typically, on a good day, you go to 5 or 6, but typically you'll have evening meetings because a lot of our clinicians obviously work during the day, and so we have quite a few evening meetings. And then you go home and start it all over again.
Now, if you get up at 5, you must go to bed early.
I do. I'm usually in bed I'm usually asleep by 10 or 9
all right.
or 10, yeah.
I'm going to make sure that I don't call you after that. And what about, it's like, what about time walking around? Do you have time to do that? Or are you really like from one thing to the next? And doesn't that get exhausting?
Well, so we require all of our senior leaders to do regular rounding.
Okay.
Where we go to all the different departments. We speak with the staff, the management, and the patients if it's appropriate. So, of course, you're not going to speak to a patient who's in surgery, but right. But we round on the inpatient patients and ask them, how their stay's been, if there's anything we can do to improve. Check in with the staff, see what their challenges are. Which I think is critical. And I'll be honest with you, it's the best part of the job.
Right.
It's absolutely the funnest part of the job. And no matter how stressed you get as a healthcare CEO, you can always go out to the floor and talk to the patients, and they're so appreciative of the incredible work that the team does. makes it all worthwhile.
Yeah, that's got to be the most rewarding part of it, for sure. Now, when I talked to Mike Vale, I asked him what's it like when you go shopping at Hannaford? Like, is the cashier like freaked out when he or she is ringing you out? So, without violating any HIPAA concerns, like, what about when you go to the doctor? Is the doctor like all freaked out that it's Chuck Hayes when
Yeah, I mean, I'd say in some instances it. You say to yourself, should I have gotten an appointment that quick, or is that
right? Right.
Are they really squeezing me in? But I think we have a great relationship with our medical staff. I mean, I would say the doctors don't get freaked out.
Yeah.
Certainly. I can't say that I don't think the staff has occasionally,
right,
to be honest with you. But,
right.
The good thing that we have a great relationship with our medical staff, and they're open, you have to have positive feedback to improve on things. You got to be able to talk to the medical staff that really deals with a lot of it.
Yeah. Now, I think you just answered this question, which is, what's your favorite thing about your job? But it's got to be the satisfaction you get when you're helping patients.
Walking around, talking to patients or residents, or
all right.
It's really the best part of the job.
So then, what's the worst part?
Trying to find a balance on your personal life. So I do think, there's an unending demand for your time, which isn't a complaint. It's a reality of the job, and quite frankly, you get paid well because you got to spend a lot of time on the job. The hard part is really finding that balance on the personal life thing. I think that's the biggest challenge.
Yeah. And also, I mean, with the complexities of healthcare and with everything that's happening on a local, state, national level, like as we speak right now, how do you stay on top of all of it?
Do a lot of reading.
Yeah, it's got to be all the newspapers.
It's all newspapers. It's all your newspaper.
Yeah, thank you. Yeah.
But it's constant. But what I tell people when I speak to them at orientation, I say to them, honestly, if you don't like change, then healthcare is not for you, because it is constantly changing. And it is. You have to stay on top of it, and even when we create our strategic 3-5 year plan, you're making adjustments, 6 months in or a year in.
Right.
I mean, it's not something that you can just say, oh, we'll follow this to the T, it's constant adjustments given the environmental changes or the regulatory changes, which are constant as well.
Sure. So what advice would you have for someone that's thinking about a career in healthcare? What are the important things for them to focus on, I guess, in their education?
Yeah. Well, I think obviously to us, when they graduate, they have the education to do the job. We need somebody who truly loves to be and care for our community, right? And so that's, I would say, just as important, but a softer part of the job. I would say probably 10 or 12 years ago, our feelings was that we're going to do the right thing to you from a clinical quality perspective, whether you like it or not. And that was our attitude. Instead of really working with the patients and the family and saying, what are your goals? What do you want around this disease process that we can work for you to get the best outcome for you? And so we've flipped that culture at Maine General, but you need somebody who really says, what is the wishes of the patient? What the clinically right thing to do is, right? And sometimes it's educating the patient, saying really this is in your best interest. Because I think a lot of times we'd tell them what to do from a clinical quality standpoint, they go home and they just wouldn't do it. Right, which doesn't help them get healthier.
Right.
So really that partnership with the family and the patient is key, and you have to have a certain personality for that. You have to love what you do.
So what's the one thing that keeps you up at night?
All the changes at the state and federal level.
Yeah.
I mean, it's constant,
Yeah.
And quite frankly, some of the federal changes are very scary.
Right.
Very scary to Maine. With the reductions that they were proposed for Medicaid, and here, we had the reduction in Medicare to fund the expansion of Medicaid that never happened. So we've basically paid for Medicaid to be expanded in other states with the cuts to Medicare. But additional cuts, given the needs of the state, is very scary.
Yeah, that puts a lot of pressure on you to continue to deliver that service, right?
Exactly.
Yeah.
I mean, as a nonprofit, what we want to do is, obviously we want to make a margin, to stay in business. Mm-hmm. But our number one focus is providing as many services as we can to the community that are needed, that the population can support.
Yeah.
So that's always a challenge when, Medicaid doesn't pay for the cost of taking care of people already. It's like 73 cents on the dollar.
Yeah.
So more cuts to that just puts huge pressure on the whole health infrastructure.
Right. Okay, I can understand why that would, that would definitely cause insomnia for certain. So describe your Maine. What is Maine to you, and where do we find you on the little personal time that you do have to get out and enjoy our state?
Oh boy, so my Maine, what I love about Maine, I would say the people and just the natural beauty. You'll find me fishing or hunting or not as much playing golf, although I like to play golf. I don't play very often. But
that
really,
Belgrade Lakes course is gorgeous, isn't
incredible.
it? Oh my gosh, it's the best.
It's incredible. But I like to be outside.
Yeah.
I like to be outdoors. So.
What are you fishing for? Are you going like freshwater? Are you going for the bass?
I go freshwater, so I bass fish, but I fly fish as well. I like to fly fish, so I like to do both.
Great. Well, Chuck Hayes, CEO and President of Maine General Health, we thank you for being my guest today on Like a Boss, and best of luck to you.
Thank you, Lisa. Thanks for having me.
Thanks for joining us, and thanks to our sponsors, Bernstein Shore, New England Cancer Specialists, liveandworkinmaine.com, Harvard Pilgrim Healthcare, People's United Bank, and Vistage. For more information on the sponsors, the Like a Boss podcast, and Like a Boss live events, visit likeaboss.pressherald.com.